Well, good afternoon, everybody, and welcome to this FemTech event designed to create a platform for informed discussion about a wide range of issues involving FemTech issues, barriers, opportunities, and some of the very positive developments we are seeing and anticipate seeing over the months and years ahead. We've got a fabulous group of panelists with us this afternoon. I'm not going to introduce them. I'm going to ask those panelists to introduce themselves, to say a little bit about themselves, their organisations, and the particular focus or achievements of their organisation. And then we'll move on to work through a series of topics covering that spectrum of issues affecting FemTech both now and in the future. So I'd like to ask our first panellist, Aaron, just to say a few words about himself, his organisation, his areas of focus. Over to you, Aaron.
Thank you, Alistair. It's great to be here. So my name is Eran Eshid, and I'm the CEO and co-founder of Fertility. I have about 25 years of experience. I know it doesn't show. In the tech space, developing anything from chipsets to AI software. This is my first medtech venture, so I'm extremely excited with being here. At Fertility, we're aiming to transform the IVF process from being a very manual, subjective process with quite poor outcomes as it is today to a fully digital, automated, and data science powered process, which creates a lot more engagement with patients and improves outcomes. So I'm very glad to be here. Thank you for inviting me.
That's great, Aaron. And I think I must say as host today that obviously you don't look as though you've been involved in the industry for that long.
Yeah, different industries. It's like dog years,
Okay, thanks, Aaron. If we can move on to Jyoti.
Amazing. Thank you, Alistair. Good afternoon, everybody. It's great to be here. So thanks for the opportunity. My name is Jyoti Sharma, and I'm CEO and founder of Tara Cares. Tara Cares was founded in May 22. So we are probably the youngest kid on the block. Prior to Tara Cares, 22 years of global experience in technology and transformation leadership and management consulting, and was working with EY in London just until 6 months ago. So Tara Cares was founded to eradicate misinformation, misdiagnosis, and mismanagement in menopause. And we are addressing that public health challenge with explainable artificial intelligence. And the way we are doing it is we are working on building an AI-driven platform that can bring more precision to how clinicians diagnose and treat menopause, but also how women are made aware. As you know, menopause is not a uniform experience. And our goal is for menopause care to become more evidence-led, integrated, and more individualized. So that's our goal. We have a big challenge in front of us because unlike maybe like some of my co-innovators, there isn't much data. So the first challenge we are tackling is creating the high quality research evidence. Alistair, you mentioned some of the accomplishments. So just 6 months old, but we've been awarded the Innovate UK Fast Start grant, which is UK's innovation agency, which has helped us kick things off. And we've signed up with University of Huddersfield as our AI research collaboration. And we have a few more things coming up. But I'm really looking forward to the discussion. And again, glad to be here. Over to you, Alistair.
Fabulous. Thanks very much, Jyoti. If I can come to you next, Christy.
Good afternoon. Morning for me, afternoon for you guys. Pleasure to be here. Thanks so much for including me. I'm Christy Prada. I'm the Chief Executive Officer of Future Fertility. I'm new to the fertility industry, but not new to the healthcare industry. Before joining Future Fertility in May of this year, I was at a virtual care startup in Canada called Maple, where I joined as employee 3 and helped to scale them through multiple rounds of financing and growth. So been experiencing the digital health transformation for a number of years now, and I'm really excited to be bringing that experience to help transform the fertility experience. I see some of the similar problems and opportunities that Erin spoke so eloquently about. This is a growing industry in the fertility space. People who go through it don't have a lot of line of sight into what the experience will look like for them based on, personalized insights about their own egg quality. So that's what our technology does. It focuses on egg quality. We're the first and only player right now that's released a commercial product that's able to help physicians and embryologists be able to assess egg quality and provide an objective assessment to understand how that could impact decision-making throughout the fertility journey, and then also giving that insight to patients so they're more empowered throughout the egg freezing or the IVF process. So pleased to be here with my colleagues in the industry and looking forward to a great discussion.
Right, thanks very much, Christy. If I could move on to Karen, please.
Good morning, good afternoon, everybody. My name is Karen Leshem. I'm the head slave at Ocon Healthcare. Ocon stands for O configuration. Everything we do is on a little ball. We deliver drugs to the uterus on a tiny little stent. There's a reason it's a ball. Because it fits our anatomy a little better than other intrauterine devices that are made of plastic. Ours is made of a stent. We already have a few products in the clinic. One is also commercial. Lots of challenges. These are very expensive hobbies. And so I feel like we're always fundraising. So we really deal only with uterine pathologies such as endometriosis, heavy menstrual bleeding. We're looking at menopause and, of course, uterine fibroids. Very big markets that affect a lot of us women. I have a team of 22 amazing people, 85% women also on the board, very important to me. And that's it. We were recently announced technology pioneers at the World Economic Forum. Really exciting because finally they see women's health as an issue that requires policy change. And so we'll be part of that policy change. I'm looking forward to that. Really excited and interested to see, I know some of the folks here, some of the folks I don't, excited to see, what this meeting will bring, and really thank you for inviting me.
Oh, thank you, Karen. Petronella?
Yeah, good morning, good afternoon also from my side. I'm Petronella Sandulake, the founder and CEO of Cordifio Health. I'm based in Switzerland. And what we are developing is a digital health platform that raises awareness of women's heart health. Probably we're the only panelist here that is not focused on reproduction or fertility aspects of women, because women are more than their reproductive organs. The reason why I founded Cordifio is from a personal story. I lost the most important person in my life due to a misdiagnosis. And I don't know how many of you know that the #1 killer of women, more than all cancers combined, is heart disease. 50% of the women, even following a heart attack, get misdiagnosed. And you wonder why is that? Is because everything we know in common diseases in men and women has been studied on a male prototype. And women are just atypical. Actually, the symptoms that women present when it comes to heart attack are not the classic, let's say the typical male symptoms, but it looks like, anxiety or panic attacks or indigestion. And women get sent home with things that can, be considered in a mental illness sphere, and then you go home and you die in 5 minutes and you don't know why. Obviously, we want to change this. We want to raise awareness around this important topic, and only with the support of amazing men and women on board, we can make a change in the world and actually advance the role of gender-centric medicine beyond reproduction. And really honored to be here with you and open to a fruitful discussion, and also happy to connect afterwards because I'm very much interested in everything you have to say. You don't have to lose your mom or your auntie or your wife from something that it's 80% preventable if caught in time. So thank you so much for having me.
Thank you for sharing that, Petronella. And last but not least, Cindy.
Thank you. I'm Cindy Moikar, and I'm the CEO and founder of For's Daughter Limited, which developed My Sisters, which is a digital platform for women going through perimenopause and menopause. And we provide a way for women to track their symptoms so they can make lifestyle changes and better advocate for themselves. And one of the reasons that's important is because one of the few things that we know is women who have more severe symptoms, say in their 40s and 50s, are more likely to develop things such as heart disease or cardiovascular disease or osteoporosis, even diabetes, 20 years later. And that's why that's such an important thing to know, although most women don't know that. And this came out of my own experience in perimenopause, which I went undiagnosed for 10 years. Before I understood what was happening. I created this I started in 2016. We're based in Newcastle in the northeast of the UK.
Great, thanks very much for that, Cindy. We wouldn't have guessed from your accent you were based in Newcastle. So it's good to hear that you're in the northeast of England. As you've just spoken, Cindy, perhaps I can start with you. I think we're all interested in what the key issues are specifically related to FemTech, both the barriers and the opportunities, and those things that would either remove barriers or accelerate opportunities. Could you maybe say a little bit about that, the key issues affecting FemTech specifically, as opposed to health technology more generally?
Sure. It's, in 6 years, the conversation has changed incredibly. We were the only perimenopause and menopause app for 3 years. I cannot tell you how many rooms I got laughed out of when I started. Now, having said that, there were plenty of people who didn't laugh. And I can't credit, the people in Newcastle enough. And obviously, I'm not a native to Newcastle. Was from Minneapolis. And there were people in Newcastle, Paul Lancaster, Chris Grant, the people at Sunderland Software City. They didn't laugh. They invited me to come over and work there. So I give them a lot of credit. A lot of them had never heard the word perimenopause. These are gentlemen who said, tell us more about this. We want to know. We want to hear about this, and we want to, develop this and understand what's happening. So I give them a lot of credit. Now, the conversation has changed a lot. We hear sometimes now, like, can we please stop talking about menopause? And the conversation in the UK is far ahead of where it is in the US. The US is now kind of starting the conversation that the UK was having 5 years ago. So that's changed a lot. And there is a lot more funding that's coming into FemTech in general. Now there's, I think, 4% of funding goes to FemTech overall. Of that 4%, 2% goes to menopause. So that's just a very, very tiny piece. And I think I said the other day that five times the amount of funding goes to erectile dysfunction than goes to premenstrual syndrome funding. Now, erectile dysfunction only affects, a very small percentage of men, like 20%, even less, whereas menstrual syndrome affects over 90% of women. Now, that's a huge challenge. So I think really the biggest barrier right now, and has been for a long time, is this research funding. The first funding and the first research study to prove that menstrual pain exists came out in March of 2021. There was actually a study that proved that on jet lag in hamsters that came out long before a study on menstrual pain in women. Now, that's insane. What is the point of that? So when you can't even come up with the first study on menstrual pain in women until 2021, that just shows you how far behind we are. Because other researchers couldn't get their funding because there was no initial study showing that menstrual pain exists. It took Apple Watch to do that study to prove that menstrual pain exists. And they took a lot of, I'm trying to think of a nice word. They took a lot of hazing in the press from women. It's like, really, we need you to tell us this? But no one had done that initial study. You know, you can't get from B to C to D to E until somebody does A to B. And it took Apple to do A to B to say menstrual pain exists. And now we can go forward. So that to me is the biggest issue, is that research funding piece into women's health from an academic level. That's what really is a huge issue. And until we get that sorted, until women's health is seen as an equal priority to men's health, we're not going to progress at all.
Thanks, Cindy. It sounds from what you said, Petronella, as though you would agree with that. Do you want to add anything to what Cindy said?
Yeah, I totally agree with you, Cindy. And actually, I would add, if this was just for the, menstrual pain in women, 2021, what I'm going to say might be a shock for all of you, but the first complete anatomy female model, the most advanced full female anatomy model available in the world, was launched early this year. Like the medical students, the future doctors in the medical schools, they've been studying everything on a male body. And the first female body anatomy complete was launched in January this year, 2022. So we're talking here about heart health of women, brain health of women. We know that women have, not only different symptoms when it comes to heart disease, but also Alzheimer's, dementia, various common cancers like lung cancer and so on. So it's not only about menopause or menstrual things. I would say that might not kill you, but if you have a heart disease or brain disease, you are gone because you do not know, and doctors will not know how to label a female patient. And only now in certain universities, the most advanced universities out there, they just started to include in the curricula the sex and gender aspects of the medicine, and the fact that, there's a recognition that women are not mini men, and we need to look at women in a different optic, that it's unique. And that's what we're trying to do with Cordifio as well. Like, women have not the classic symptoms, and that's why we need to recognize them early, because it can be something between death or life or death, you name it. But just to say, the complete anatomy of a female model launched this year in the whole history of humanity. So here we go. And it's exciting that we are all here together, because digital health might play a huge role. And with all the, the startups active in this field, I think we can approach the problem and achieve something, as I like to put it, one heart at a time, and then creating those multipliers and ambassadors to spread the word, literally to save lives.
Thanks, Petronella. Well, that example speaks volumes. Erin, you've been involved in a number of different industries, and I think you said you're relatively new to FemTech. How do you see some of the specific barriers, but also opportunities with reference to FemTech particularly?
Yeah, actually, the figures and the the numbers are quite shocking that we hear here. And it's good to know that things are starting to change. Interestingly, when we categorize in vitro fertilization as femtech, it does have a masculine angle, which in our specific industry is actually in many cases overlooked because the reasons for infertility are not women's issues only. There's about 50% that belong to men. But of course, the impact on women of a failed IVF, a successful or a failed IVF process are, far more significant. In the IVF space, actually, I'd like to bring a slightly different angle to the challenges that we're dealing with because it's an established market. IVF has been done since, I think the first IVF baby was in 1978. So we're talking about 40 years of treatment that actually has not advanced all that much. And one of the issues that we're dealing with is change management. How do we make clinicians and embryologists and IVF professionals trust technology where, in fact, and this is, I say sadly, clinics are full and everybody's making, a good living. At the end of the day, the average success in a single cycle is 30%. So you have to, anywhere between 2.7, 3+ cycles for a baby, in case, of course, it's successful. But there's very little motivation from the, community, not the patients, of course, the IVF professionals to change because it's a very robust business. So our challenge is twofold. A is why do you need to change? And, one of the things we need to not do is overpromise because technology is not magic. And in our case, AI, data science, digitization, big data, all of that, these are great tools, but they will not take that 30% and make it, 80%. There's some biology involved in all this. So first of all, expectation management, and in light of improved outcomes, but not, dramatically improved outcomes, how do you make these guys or gals basically change what they do today? The second thing is how do you create that trust, especially when we're talking about technologies like AI, which are some kind of a black box. I mean, even engineers, and I'm an engineer by training, and I've been dealing with AI for, quite a few years. Explainable AI, as we mentioned, is not a trivial thing. We call it transparent AI because we're actually not trying to explain AI. We're just trying to connect the insights that AI provides into the biology that these IVF professionals understand and hence can relay to their patients. And that, reduces anxiety and helps, a better patient care and better patient experience. So I would say these are the two challenges. How do you make these professionals change what they do today? And how do you make them trust in the technology that will drive that change?
That's really interesting. I'm sure we'll come back to the question of technology, Aaron. Jyoti, thoughts, barriers, opportunities, key issues affecting femtech particularly?
Yeah, thanks, Alistair. Well, let me just focus on the menopause space, which is where we are trying to create change. Completely agree everything that the previous speakers have spoken, and let me take it to just one level down. I think we will all agree that we've not been intentional with women's health in general, and more so on post-reproductive medicine. So one of the challenges we are trying to tackle and a problem we are trying to avoid is what Iran is facing in terms of fertility, because fertility, IVF is an established market. Menopause is still getting started, and we are trying to avoid the use of wrong language. So menopause is a biopsychosocial phenomenon. Yeah, it's not just one thing, number one. Number two, the language we are using, the terminology. To give you one example, early menopause, one of the causes is what is now known as premature ovarian insufficiency. Until recently, it was called primary ovarian insufficiency. the cognitive and psychological impact to a woman when you say you have primary ovarian insufficiency is devastating because she thinks she has a problem. That problem is not in her control. So one of the barriers that we see is the use of language. Another term, menopausal. Tara Cares will never use the term menopausal. It gives me goosebumps every time I see that term because no woman wants to be called menopausal. It's a label. We are not labeling people. So that's a couple of things there. And the second bit, Cindy touched on research. Even if you do get funding, what is the robustness of your research methodology? So the UK government, the first report that was commissioned by the Department of Education on the impact on economic participation of women in transition who are in menopause transition was published in July 2017. I think the researchers did a very good job. Their study protocol included studies which were above the quality threshold, but each of the studies were found lacking in research methodology. So, there are companies that are sending surveys out and really giving themselves a pat on the back with the number of responses that received. Great, that is a win in itself. But, for example, at Tara Cares, we are doing mixed method studies. So we are not just sending surveys out. I have personally completed 3,000 hours of qualitative interviews. There are things that you need to have a human interaction with. So the way you are doing the research, the way you're disseminating the research is very important, according to us, in terms of, so that we are not in the same place where in 10 years, women think there are only 48 symptoms, for example. I mean, if you look at social media, I feel companies are having a war of words in terms of, oh no, we've got 35 symptoms, 51 symptoms. No, there isn't a defined list because research still needs to be done. And it is individual differences. It's symptoms that women are having that are not being talked about. Asian women have more muscular joints and those sorts of issues. White women have more hot flushes. But if you just keep talking about hot flushes, see what you're doing. You're creating an unconscious bias in the way people understand the problem, in the way you define the problem, and hence you are steering the entire community to a wrong direction. And that's what, with everything we do and literally with all the innovators here, I would urge that takes a lot of effort. Every single decision, especially for me as an early stage startup, you can imagine it's very difficult when you're trying to make those conscious decisions, but they need to be made in order to create the right trajectory. If we are really interested in solving the problem and not being reactionary and creating a symptomatic narrative for any female health issues that we are tackling. So that's what I wanted to add. Hopefully that helps.
Yeah, it does. Thanks, Jyoti. Christy, thoughts?
Yeah, thank you. That's all been very enlightening, and I couldn't agree more with all the different themes. Maybe I'll flip it on its head a little and point to a more optimistic opportunity that I see in the space. So in spite of all the challenges, lack of investment, innovation, focus on female conditions, I actually think that the growth of the movement in healthcare in general towards an empowered and engaged patient is really helpful. You combine that with the shifting social dynamics in the household where females have more money, are key decision makers in the household, more engaged in social media. Infertility especially, we're seeing more females coming out and speaking about infertility issues. I think that growing narrative of the engaged patient and the growing movement we're seeing actually creates a ton of opportunity in this space to leverage that, to have conversations that highlight the need, highlight the areas of opportunity, highlight the interest from patients and being more involved in their care, being key decision makers in their care journeys, and pushing investment, research and all of that in the right direction. So I think that these things are very positive. Certainly, it's not without its challenges in the industry, but I think that I have a lot of optimism for the future because of that growing dynamic and the shifts that the digital revolution and engaged people are creating.
Thanks very much for that, Christy. And Karen, do you share that optimism?
Well, I want to talk on the investment side a little bit. I know there's been a shift lately with a lot of information about companies that have raised some funds. But what's really, really frustrating is that you see a few millions or tens of millions being raised to specifically cater to women indications, right? So these are only women that are going to be studied. But you see a multiple of investors, sometimes 10, 12 investors coming together to invest, such a small amount of money. And so there's still very small checks that are being given into the industry. And, from my experience, it may be a little funny, but we have a full portfolio or a pipeline of products. And when we show investors, this is for this disease and that pathology and this indication, they look and they go, wow, this is such cool technology. So can you use it in other parts of the body? And I always say, why? We have at least 7 indications that we can do in women. And it's always about, what else can you do in addition to what you're doing? Because women's health, it's changing, but it's still looked upon as a niche. And when we say femtech, female technology, that also kind of brings in, health and sex and wellness and all kinds of other issues that makes it a little hard to be a little bit more focused. If it's on reproductive or if it's on aging or if it's on, other indications and pathologies. So still frustrating, like I said, these are expensive hobbies. Each clinical study for therapeutics is tens of millions of dollars. And so we need to see a little bit more focus on investments in this space if we want to get, move away from the fact that we're not little men. As Petronella, perfectly put, we have different bodies, different, systems. Everything is different. I always laugh and say, women are very different from men. We have different organs. And I don't mean the brain. I mean, we have a uterus, but that changes the whole cycle, the whole hormonal cycle. And it affects every, age group, period. It just affects every age group, younger or older. And so really calling out for more investments and a lot more collaborations to make sure that, these smaller little companies kind of maybe even join forces. I get so many requests to help for entrepreneurs, a lot of them working on the same thing, drug delivery to the vagina, drug delivery to the, wherever. And we need to make sure that we can focus on building technologies and therapeutics and apps that kind of speak together to make sure, when we do have investments, they invest in the best product for women out there.
Thanks, Karen. Well, let's stick with that question of how we accelerate or how you might stimulate a sort of acceleration of research and investment as well. I mean, Cindy, you talked about some frustrations with research, particularly some of that primary work. Any thoughts on, working together or individual businesses, how the sector can stimulate more research and more investment and a more accurate sort of proportion of research and investment?
So you being based in Newcastle, we've had the distinct privilege of working with the Newcastle University data scientists and the Newcastle University Business School, and that's been amazing. But as you can tell, I'm American, and recently there have been issues in America with the Dobbs case, which overturned Roe, and there have been a lot of privacy concerns now with women using apps and any kind of digital health product. And I think that is going to have a huge impact on any kind of research into women's health. I know it's impacted my sisters. It's impacted any app. And so I think that's going to be the challenge, data privacy. And even though right now it's sort of centered on that sector of women's health, I think once people realize just how much of our digital information is being collected and sold, my sisters doesn't share or sell information, but I don't know what our customers' phones do or what it's sharing. But I think this is going to affect diabetes apps, apps that monitor health conditions or heart conditions, fitness, the steps that you're taking, all of that information. A lot of the women in the US they're no longer using those apps at this point. And that is the information that it needs to be collected and shared for any kind of research for women's health. And right now, women aren't using those. I think once men realize how much of their information is also being collected and shared and sold, that's going to be an issue for them too. They're going to realize just how much of their information is at risk as well. In the US, a lot of our financial information is also being shared and sold. And a lot of people in the US don't realize that. Anytime you make a purchase, all that information is sold. So I think that's going to be the big impact right now. I don't really know the specific answer of how we can work together until we have more protection for our data, number one, and number two, those protections aren't so onerous that small businesses aren't able to comply with them. Because a lot of the protections that are being talked about in Europe are so onerous. I mean, some of the proposals would put innovation out of reach for startups. And I don't have any good answers to any of those, quite frankly.
Thanks, Cindy. I mean, you raised some big issues. I know that data is going to be central to a whole range of the things that we've discussed here today. But Christy, you talked and touched on some of the reasons for optimism. I mean, thoughts on accelerating research and innovation and investment?
Yeah, absolutely. I think the data one is a key one. Of course, there's a need to keep a level of data privacy so that individuals can feel comfort and confidence in using applications and new tools. On the flip side, companies like ours that are building AI that are based in data need access to that data. So, finding ways to make data readily available and accessible to companies like ours to be able to access and use in a safe and careful way for patients. There are some good advancements in this, in our industry. And when I say our, I mean the industry that Erin and I are in. The European Society of Reproductive Endocrinology has recently announced an initiative where they're working towards a European data repository so that companies like ours and clinics and academic researchers can have access to data. So I think initiatives like that, where countries or organizations can come together and find ways to make available information and connected data to allow us to use it in a safe and respectful way is going to be critical. And then the other element that I think is important in terms of stimulating investment or innovation and research is finding ways to invest in and support collaborations between private companies and academic or clinical partners to ensure that the way tools and technologies are being developed, that they're doing so in a compliant, appropriate way, and also in a way that really solves the medical challenge at hand, while also validating that the technology works. So those are, I think, the two big, both maybe challenges, but also opportunities with creating innovation in this space. And it's been refreshing for me coming from the primary care space in Canada, which is a little bit more restrictive in terms of data sharing and embracing technology, to an industry like fertility, where you have a lot of private clinics that have access to data and are considering sharing them, collaborating with players like ourselves, and interested in finding new ways to co-develop products.
Thanks for that, Christy. Petronella, any thoughts?
Obviously, to foster innovation and also investment in new innovations, perhaps the industry should, stop wasting resources. For instance, 8 out of 10 drugs that get launched on the market get withdrawn from the market because women have side effects and they haven't been tested in women, but not even in female mice, so to say, or on female cells. So 8 out of 10 drugs get withdrawn from the market. You can imagine, to develop a drug, how many billions of, even taxpayers' money gets wasted on something that actually is not going to see the light of day because 51% of the world population hasn't been taken into consideration. And here we are as a big challenge, like when we go to VCs, VCs is a different type of kettle of fish, so to say, but even research within academia, but also in the big corporates and so on, in the government, it's like all those funds that get, just, I don't want to say wasted, but it's like, it's a loss of opportunity. And then us, like here on the panel, we are trying to advance health equity by actually focusing on, I would, not even say niche market, because women are not niche market. We're 51% of the world population. So we're the majority of the market. We would appreciate support to focus on this kind of a challenges. And also within the women population, we should look at ethnical backgrounds, because we know that women of, Hispanic descent or Southeast Asian or women of color, they have different risk probabilities, at least from a cardiovascular perspective, but also metabolic perspective, pain management, and so on. And it would be wonderful to access those kind of funding. And then just what Christy was saying, that kind of a collaboration, support the collaboration between researchers, startups, academia, and corporates. That will be wonderful, because that's how we're going to innovate truly. And it's not only incremental innovation, but actually innovation that could change the face of how we prevent diseases, how we deliver healthcare, how we think about therapeutics, and also taking into consideration the rise of digital health and digital therapeutics.
Thanks, Petronella. I'll bring in Jyoti and then Erin. Jyoti.
Thanks, Alistair. Perhaps too, I want to touch on the data aspect in the research. I think the first thing we have to question ourselves, why, the ruling in the US and why there's a fear on data privacy, because conventionally companies have been selling the data. So whether some of us like on this panel or not, companies have to amplify their game and their commercial models. You've got startups whose whole commercial model is around selling data, right? So that's a very stark and honest question that companies have to ask. And even new startups like myself have to really look hard at our commercial models and see how are you going to monetize it. So that's one aspect. The second aspect around research collaboration, for me, there are two dimensions to it. One is absolutely, the first thing we did was looked at, I'm based in York, and I think I would like to definitely put it on record. I am not from Yorkshire. I'm not from England. I'm Indian origin. I moved from London to York, and I can't be more grateful to the support that I have received from northern part of England. So the first thing we did was looked at all the universities in northern England and finally found the right academic at University of Huddersfield for our AI research. That needs to continue. The barrier over there is that early stage startups can't do knowledge transfer, those sorts of relationships. So again, we are a bit early in some of them, but yes, we've established our research collaboration with them to the Innovate UK grant. But coming to Karen's point on how do you identify the synergies on the problems that people are solving, especially something like menopause. It has secondary health conditions, to Petronella's point, on cardiovascular disorders. That's one of the leading killers of women, right? I would be completely open to speaking to any company that shares our values and shares our commitment and integrity to have a chat and say, hey, how can we bring our resources together? Hey, if you're pitching to these investors, how can we be smart about it? So personally, as a founder, I would be absolutely open to having those conversations and initiating that shift in the market. That's how, because we are all in this together, we are unified in the objective of equitable women's health at the end of the day. So that's what I wanted to add.
Thanks, Jyoti. It's a really interesting point about the role of collaboration, and accelerating some of the things we've touched on, like investment and research. Erin, I think you wanted to come in and say something.
Yeah. I hate to be the party pooper in saying that there's an elephant in the Zoom, pun intended. An elephant in the Zoom, and that elephant is that we are all funded by venture capitalists and private equity firms. And at the end of the day, it's a very competitive market. So the expectation that, we will all be sharing data and collaborating with a joint objective, altruists rarely get funded. In a way. Now, what I think we can do, and I actually have a pretty good example of what we in the fertility community do, is there's so much beyond just the core, data and algorithms and even IP sharing, which at the end of the day are assets that companies invest money in and shareholders expect to get returns on. But there's things like the regulatory framework. The standards of, and I think this was mentioned before, the standards of how you perform research and what is considered to be clinically, valid, significant. We can, as a community, define all of these guidelines. We can educate regulators like FDA on what this technology is about, what is the best way in going about regulating and testing and checking that it actually is clinically valid. And in the fertility space, we just started, like in the past couple of months, we call it the AIF. It's the AI Fertility Society. And this is a society that has different, like 6 or 7 different work groups, and each of these different pillars of, what builds the ability to promote these technologies in the market. And in these work groups, we are collaborating in a very open way, and we teach each other from experience. And then we would go into the regulators and an academy and establish standards that will help all of us not waste these scarce resources on things that eventually will get, pulled off from the market, or just so much research that at the end of the day, you look at and you say, okay, what did we as an industry gain from all of this research when half of it is not even clinically valid, right? So I think there is a lot that we can do from a collaboration standpoint, but we also have to keep in mind that these are competitive organizations. They're funded by shareholders. And at the end of the day, we need to show results and returns. And some of this is, our competitive advantage. My company has been around for 3 years. Initially, we got very little data. It was pretty bad. I mean, I had to physically collect it with a hard drive. Nowadays, it's just flowing in almost in a seamless way because our partners understand the value in sharing data with us. It improves their outcomes. But that's one of our competitive advantages. But there's a lot of experience that we can share that can help us as an industry.
Thanks for that, Erin. Anybody else want to follow through on that?
Well, yes, maybe a quick point. I completely agree to everything that Erin says. I think some of the women on this panel may say that we need to educate the investors as well. Completely, VCs are, as Petronella mentioned, they are very different. Of course, their motivations are different. And so I think as founders, we also have to be creative. Is VC always the answer? I think the market is so dynamic right now, because here's the deal. If you're really intentional about being research oriented, being evidence led in everything that you're doing, trust me, there are many in the market who would support you, right? And maybe there is a different stage. Maybe you never go to a VC. Maybe you work a bit harder on your commercial model and become self-sustaining. So I'm not refuting to anything that Erin said, but I think that there is this whole funding issue also requires an education of the investors. It's not about sharing a competitive advantage. It's about coming together to sharing the resources. And I think the research database is an amazing example, which, for fertility people, it's a blessing you have that. For menopause, we really don't have much good data that we can go off of. But that's the goal that we are working towards, and have it as a federated model that all companies can actually use. So that's what I wanted to add. Thanks for the thumbs up, Erin. I appreciate that.
Thanks, Jyoti. Can I sort of move the discussion on a bit to patient support and access? There's so many good things in development at the moment, new products and new services relating to some of the specific things that we've touched on. How successfully as an industry is that message getting through to patients, and are they getting access to new innovations and new developments and new services? And are those services moving from development to the patient quickly enough? Maybe if I could ask you, Cindy, to maybe respond to that firstly.
I think it really depends on where you are and how active patients are in their own health. I think digital health has really had a leap forward because of the pandemic. And I think people who might not have adopted that form of healthcare without the pandemic did, because that's what was available. I think in certain parts of the world, there still needs to be a bit of infrastructure to make that a little bit more available. I think that there is a lot of opportunity yet to make the most of those tools to reach people. As wonderful as the tool of that digital health is, it's only as good as the people who are willing to use it. And by that, I mean the health systems, and in countries where the government runs the health systems, I think sometimes the government officials need to understand how to use it, and they don't. I don't want to call them dinosaurs, but sometimes they don't really understand what digital health is. Sometimes when you, she's laughing, but sometimes when you meet with people and you're trying to explain how they can use digital health to reach communities and populations that they're not really speaking to, and that may not visit the doctor as often. And in the menopause space, there's a lot of health, and FemTech in particular, there's a lot of health literacy that needs to happen. There's a lot of education that needs to happen. And there are populations that the health services don't reach in the way that they need to. And sometimes when you're trying to explain how digital health can speak to those communities and help those communities, the people that you're speaking to that are supposed to know what they're doing don't. And so they don't understand that digital health isn't it isn't a watch that they wear on their wrist, that it's software. It's not something that they can look at. It's, yeah, so you're trying to explain something to people who don't really understand that it's not something that they can hold in their hand necessarily, and so that's a bit of a challenge. But I think that there's still a lot of opportunity, but sometimes you have to, when you're explaining it to the people in power, you have to sort of bring your digital health product with something old school like a poster just so that they can have something to look at. But yeah, I think it's great that it's a way to reach populations that might not have access to the service.
Maybe if you use an overhead projector, Cindy, a flip chart. Petronella, I mean, it is a big issue, isn't it? You know, even when the products and services are there, the people that they're aimed at, knowing that they're necessary, knowing what's available and having access to those services and products is at the heart of this.
Well, definitely access is crucial. Like, you can develop a digital tool, but as Cindy said, if you cannot reach your audience or the getting involved, the users, the patients or pre-patients, then you cannot do anything about it. And that's when it starts with, just would like to echo what Cindy mentioned, the health literacy and the education aspects behind a digital tool. So there's a lot of work from our side to, reach as many people out there and educating, also thinking about the kids or in school or partnering with councils and trying to get everyone on board. Because what's interesting in the FemTech space, or what we're trying to do, is that we know that women are caretakers, they take care of everyone apart themselves. And they're the last on the list of their priorities. They take care of their, the kids and the husband and the family and everyone else, but they don't care about themselves. And that's a challenge. And that's what we're trying to do also by engaging the kids, or even the husbands or the men. They need to be involved because they see things in their women that don't necessarily see themselves. And and the patient support groups are crucial. Like, we've created a network of global ambassadors. These were women with lived experience, actually women who got misdiagnosed, women who watched death in face. They had heart attacks. They survived. They're alive because of a miracle. And they are the greatest ambassadors for what we're trying to do, because you don't want other people to experience the same type of thing and become a patient. Like, once you have a heart attack, your life is going to be completely changed. And actually, your level of energy and so on is going to be so different. And that's why advocacy, patient advocacy, is key in promoting digital health. And it starts with the patients who are the most supportive and coupled with this mission, and then propagating within their networks. I'm a big believer of word of mouth, although we have social media and so on, but the ones, and that's how you build trust. It's more or less what Jyoti was saying, you have to build trust and keep the confidence in the people. And how do you build that? Well, I will listen to my friend or my auntie, not so much to social media. And that's where the confidence groups and the trust groups get created to actually propagate the new innovations that are happening in digital health.
Thanks, Petronella. That's really interesting. Jyoti.
Alistair, very quickly. So for me, I have to give a round of applause to the National Institute of Health and Care Research. I was in a session just 2 days ago, and there's been so much work done on, bringing patient and public involvement in research to the forefront. So we're currently working on a huge NIHR bid, and I know not many founders want to do that. They quickly want to go to the VC. But I think my question to any founder, including myself, would be how much has it been co-designed for the people that you are working for? That's a very important, and those decisions are being made quite early on. So if it's not being co-designed with people, if people were not involved throughout the process, then you're immediately already shot, you bypassed a big population that needs to use it. The second aspect is affordability. Probably not many founders think about affordability. For me, I want to reach the woman who in Uganda who cannot afford even 2 meals a day. Okay, so that is key for me to really look at my model from every which way to make sure that it can still be a business, but not at the impact, at the cost of impact and reach to the people. So those are two bits. And the third bit, again, what Petronella mentioned, you need to listen with your heart. You just have to. If you're not listening to your patient with your heart, then you need to see the person behind the symptoms. And we are not leaving men behind. You know, our biggest audience right now is men. The pitches I have done, the taboo is so deep-seated. Women don't ask me questions during the pitch. They come backstage. It's men who ask the questions. So the platform we are building, there is a space for men, for them to care for their partners. Because the generational conditioning of women not to be self-aware is so deep. I mean, I can't tell you, we just publish an advertisement. Women in their 30s see menopause, they say, don't care, we are too young for that. You could be early menopause. Women in their 40s are in complete denial. I'm too young to have menopause, right? And they also think that you need to have some symptoms. No, you could be having a completely natural, healthy transition. It's not a disease if it's natural. And if you've made good choices in your life and have had a healthy life, you may not have any of those symptoms. So they sort of disqualify them, and that's giving me a mental note, oh my God, that tells me how deep it is. And you have to be, even as a researcher, you have to really be so conscious about every single word you put there. So those are the 3-4 points that I wanted to mention. And accessibility in your app. And 2 nights ago, I was breaking my head on the font to use for text scaling, because I have friends who are dyslexic. I have friends who have neurological disorders. And if they can't read it, that's a problem. So for me, menopause especially should not be a rich person's privilege, which unfortunately it already feels like it's becoming a rich person's privilege when companies are, releasing wearables which are 300 pounds. Seriously, you're paying 300 pounds for a 45-minute consultation. I used to have a 7-figure salary. Even I wouldn't pay that. So those, I know I'm very passionate about this, as you can tell, but for me, it's important. The patient, the public, the person is key in whatever you're doing and creating. Yeah.
And I guess even more crucial, given the cost of living crisis. And
100%. 100%. In the UK, I asked women, would you pay for this? No, we expect the NHS. And fair enough. So we are working with the York Health Economics Consortium already for early economic modeling of our platform. But again, I'm telling you, it's not easy. It's not easy at all as an early stage founder to do these things. But these are very conscious decisions that we are making so that the path that we are creating for ourselves is a bit more robust, and it actually, reaches the people we want to reach. So, yeah.
Great. Thanks, Jyoti. Karen, any thoughts on patient support and particularly access to the kind of innovations we've been talking about?
I think that the biggest point here is education. And I think the responsibility of education lies on a number of, groups, if I can say. So because we are in a space that still suffers from taboos and still suffers from lack of knowledge and still suffers from normalization of symptoms, I think us as companies have the responsibility to educate. Our governments have responsibility to educate, the bigger pharma or the bigger companies, and also the doctors have the responsibility to educate. We just need to make sure that, we don't only develop technology, but also make sure that it could be an educational tool to women, just to show them that they have options. right? There's no one company that does everything or one company that is the best. There's tons of different options for different diseases. And also, although we're all women, we all, are treated differently, and we also behave differently to certain, drugs or treatments. And so I think it's about education. And the more we do in the education front, I think the better that will be for everyone, for our doctors, for our, families, and also for the women that suffer from any of these conditions.
That's great. Thanks, Karen. We've covered a lot of ground, and we've been talking for a little over an hour. So I'd like to sort of start to moving towards a conclusion. And I think to do that, it would be nice to go around all of our panel and just ask, I suppose, for final thoughts on what they regard as the priorities, the things that they would like to see change, the things that they think will have a significant impact in accelerating progress in some of the areas that we touched on. And I'm going to start with you, Karen, because I think you have to leave fairly shortly. So just in case you have to leave us, maybe you could give us your final thoughts and priorities.
Well, again, I'm really, really excited to be in this space. I can tell you that myself learned a lot on my body, on my symptoms, on my perimenopause, just from being in the space and being educated from the companies around me. And so I think we're doing a great job. I think there's a lot of innovation and a lot of thought given to women's health. If it's with digital health, if it's with pharmaceuticals, if it's with diagnostics, and if it's with devices. And so I'm very, very optimistic. I can't wait to see some of these products in the market succeed. I think that any of us that succeed bring up the entire industry with it and focus. And so I do believe we need to collaborate, and I do believe we need to help each other. That's what I do. The more exits and the more investments will help all of us get more exits and more investments and put this space kind of in the limelight. So yeah, excited to be part of this industry. I don't remember who said it. I think Cindy did. But it's changed so much in the last few years, and it will continue to change. And so, yeah, just very, very optimistic. Thanks.
Great. Thanks indeed for that, Karen. Erin, final thoughts?
Yeah, I'd maybe like to highlight an angle I don't think we mentioned, which is basically a patient empowerment. What I would like to see is I would like to see the healthcare professionals, and specifically in our case, the IVF professionals, being more transparent and sharing data with their patients. Shockingly, we offer so much information that can explain what happened throughout the process, and clinicians, mostly, if I may say so, mostly men, are just completely anxious with sharing it because it may cause too many questions. And why is this happening? Why is that happening? And what if? And the thing is that these patients, they actually read the whole internet before, specifically in the fertility space. They read the internet and then they go to treatment and they ask questions and they expect, and this is also a generational thing, right? I mean, when I was that age, I didn't even know what to ask. But now patients, they know what to ask. But there's this fear of sharing too much information. And I'm saying, let's be transparent and patients own their data. It's actually not even yours as a clinician, it's the patient's. So share it, open it up. It will make you better as a clinician. It will force you to come up with better answers and maybe invest more in research to be able to answer next time you're asked. And this is just one angle in patient empowerment, which in the case of IVF is surely going to improve outcomes, because in the case of IVF, as an example, there's a very significant dropout after a first cycle. Okay, anxiety, expectations, that were not managed correctly. It's simple to do, and we need to do this, for the betterment of our patients.
Great, thank you for that, Erin. Cindy?
I think one of the things that has changed the most over the years is the stigma. There were words that you couldn't say in a meeting even 5 years ago. That I remember a couple of years ago, there was a program, Tech for Ava, that Petronella and I both had the privilege of being part of. But maybe a year and a half ago that we started, and the first and the opening, I don't know, ceremony, whatever it was. They were talking about things and parts of the female anatomy just openly on stage. And I just remember sitting there thinking, oh my gosh, like these are my people. Like, they were using female body parts that I had learned very quickly that I couldn't say in meetings because it would just shut things down. You could barely say the word menopause. And you could just see the faces sort of close up. And I think, going forward, I'm really hopeful that the stigma will be even less because, when I first realized that a lot of what I was going through was menopause, just trying to talk to my friends about it, like nobody wanted to talk about it at all. And now that it's becoming more open, I'm hopeful that the more we talk about this and the more it's just sort of out there, I've learned to sort of be in people's faces, and that just forces people to get over it. And I think people are getting over it more and more, and people won't be so embarrassed, men or women, and we can just talk about these things as quote unquote normal.
Thanks for that, Cindy. Final thoughts, Petronella?
Well, I have 3 final thoughts here. Definitely, digital health is here to stay. It is an empowerment tool, but without the support and access and willingness of all of us to adopt it, and knowing that our data pools are secure, there's privacy security, that we as users, but patients and so on, we are in control of our data sets. It's fundamental. So digital health, data protection, key to advance all this new wave in the medical field. The second thought is around the fact that FemTech is more than reproduction, and that's why the importance of advancing sex and gender-centric medicine is fundamental. And it's fundamental to learn about the differences in biological differences between men and women and also beyond. There are also many differences in the healthcare system when it comes to the community of LGBTQI and so on. They are misdiagnosed and so on because there's not a lot of knowledge around that. So advancing sex and gender-centric medicine is fundamental. And the third and last thought is around raising awareness and prevention and early detection. So for cardiovascular diseases or strokes and so on, it's 80% preventable if caught in time. And this is amazing. Like, if we know this, if people are aware of the differences between men and women when it comes to symptoms, we can save so many lives. And here we go, where prevention, and I feel like the digital health will support prevention, although prevention is still a bit of a gray area when it comes to the commercial aspects of how to get economic benefit, who's going to pay for prevention. And that's where the empowerment comes with, the women and men adopting this and believing that if they keep themselves health, so healthcare is care for your health, do not go to healthcare when you are sick. So it's a little bit also a systemic change in that. So raise awareness, prevention, early detection through digital health.
Excellent. Thank you, Petronella.